Hi everyone. If you are watching this video, I hope that the educational printout had helped you gain valuable information in treating your condition. This video is going to talk about the distal radius fracture, and it is going to elaborate a little bit more about what the packet was talking about. During your first visit, your therapist might have made you a wrist cock-up orthosis, which is pictured to the right, to help relieve with your symptoms of a distal radius fracture. Also, during that first visit, your therapist should have checked off when they wanted you to wear the orthosis. Could have been at all times, nighttime only, or any other time that was written down in your educational material printout. These splints can be washed using cold water or wiped with an alcohol pad. If warm water or hot water is used with these splints, then the splint can mold into a different shape and it wouldn't be used correctly. Here we will talk about prefabricated braces. These items can be purchased whether online, on Amazon, or any other big store like Walmart, CVS. They can also be purchased in person at a Walmart, CVS, Rite Aid, whatever it might be, to support your health management of a distal radius fracture. These braces are considered to be a wrist cock-up, like the orthosis that we talked about on the previous slide, and they can support and protect the fracture. The wear time is the same amount of time marked in the previous slide and that was marked on your printout. You want to make sure you wear it snug for protection, but not too tight where there's discoloration in your fingertips and your hand and it affects your blood flow. So, what is a distal radius fracture? A distal radius fracture is a fracture that is located at the end of the forearm, about 1 inch from the wrist. It could vary, but it's usually around this area that's 1 inch before the hand. The radius is the fractured bone, and this is located on the thumb side of the forearm. So as you see in the picture to the right, it is the bone that's on top, closer to the thumb. It is the most common site for a fractured bone in the arm. Here we will be talking about some symptoms you might be experiencing with your distal radius fracture. Some symptoms include pain, soreness, bruising, and swelling around the injured area or fractured area of the bone. Other possible symptoms might include numbness and tingling in the hand and fingers, and these last symptoms might indicate nerve damage to the injured site, which in turn might delay the recovery period in your therapy sessions. There are many different ways a person might get a distal radius fracture. The most common cause is a fall on an outstretched hand. Sometimes you might hear this as a fouche, which is an abbreviation of a fall on an outstretched hand. This injury can occur through high-level accidents like a car crash or a fall from a high elevation, or it can even occur in a simple fall on the wrist in an older population and younger, but especially with those with osteoporosis, which is a disorder in which bones are more likely to break because they're a little bit more fragile. So here's the question that a lot of people like to ask. How long does it take for me to recover? The recovery time for a distal radius fracture is different for everybody as there are different kinds of fractures. The recovery time depends on how the bone itself was fractured. If the bone is not too misaligned, then a cast can be put on, followed by occupational therapy or hand therapy in general. If the bone is not in a good position, then realignment is needed with or without surgery. A surgery for distal radius fractures would require the longest recovery time period. Most of the time, People return to activities around the 3 month mark, while full recovery can take up until 1 year or more, depending on the person. Fractures tend to heal after 8 weeks, so strengthening is needed to get back to everyday activity after these 8 weeks of working on your motion for your fracture. Another common question is whether a person should use ice or heat. What I will say is both have a time and place. Ice is beneficial to use right after an injury, especially during the first 48 hours to bring down the swelling and bruising. But I'd say for a distal radius fracture, you can be a little bit more aggressive with the ice and use it for a week or so. Ice can be applied for 10 to 15 minutes in the area with 2 layers of towels in between the skin and the ice, just so there is no chance of frostbite. Ice can come in the form of an ice pack, or an ice pack can be created at home by filling a bag with water along with peroxide or any other form of alcohol substance for that matter. You would tie the bag up, put it in the freezer, and then let it freeze. Some benefits of ice are reducing pain and decreasing swelling for your distal radius fracture. Another modality that could be used and beneficial would be heat. This would be a little bit later down the line after ice, but heat can come in the form of a hot pack, which you might see in the therapy office, or you can create your own at home by making a bag full of uncooked rice, heating it up for 30 seconds to a minute, and then you still want to apply 2 layers of towels between the skin and the heat source, and you want to apply that for 10 to 15 minutes at a time. Some benefits of heat include pain relief, an increase in blood flow, which in turn promotes healing. So the more blood flow in an area, the more likely it is to heal. It also improves extensibility, or in other words, it loosens up the muscles in and around the area. It also decreases stiffness. So here we have the first of your home exercise program for a distal radius fracture. In your educational material printout, it mentioned the amount of reps, sets, so the amount of times you would do this per day. So all of that information is there. I'm just going to elaborate on the pictures at hand. So as we can see, for these tendon glides in the top left corner, we're going to start with our hand nice and flat. We'll just have our elbow on the table, hand up nice and flat. We're going to go into a hook fist as pictured in the second picture in the top row. So you're going to curl the tips of your fingers and the middle of your fingers. And then in the third picture, you're going to make a full fist. After a full fist, you are going to go into what is pictured in top right corner of the slide. You're going to straighten your fingers out. You should see a 90-degree angle with your fingers being horizontal and your hand being vertical. And then what you're going to do is pictured in the bottom left corner, you're going to fold your fingers down, but only at the middle knuckles, right, as pictured in the bottom left. And then you will be done. And then you would start all over again and make sure you do the same amount of reps that it says in your printout. Here we have some more home exercises for your program. We have wrist flexion and extension, otherwise moving your hand forward and backwards. You'll start with your hand nice and flat as pictured all the way to the left. You'll start to move your hand forward like the picture in the middle. You're going to move forward as much as you can go. If it's a little too extraneous, the pain, ease up and not go as much as you would. And then I want you to move your hand all the way back into extension, again, as much as you can go, like the picture all the way to the right. every week, you'll be aiming to go a little bit further each time, but to start off, we'll do what we can. And again, you'll follow the reps and sets that are on your educational material printout. So here we have a few more home exercises, radial and ulnar deviation. What you are going to do is start with your hand flat on a table. You're going to have your wrist nice and straight, aligned with your forearm as pictured in the big picture to the left. What you are going to do next is you're going to shift your hand without moving your forearm. See how the forearm is nice and straight still in the picture in the top right, but your hand is shifting toward your right. Again, we'll go as far as we can go without too much extraneous pain, and then I want you to shift all the way to the left as pictured in the bottom right. So lastly, we have pronation and supination as our home exercises. You want to start in the position pictured in the top left picture. So you want your bicep part of the arm, your upper part of the arm up against your ribs. You want your arm to be a nice 90-degree angle, so the elbow is going to be bent. Your hand's going to be out in front of you. And then you want to turn the palm down as shown in the top right picture. So it'll be turning down while keeping the bicep and upper part of the arm against your ribs, and the arm is still at a 90-degree angle. And then once your palm's facing the ground, we'll go as far as we can, and then I want you to turn your palm all the way up, pictured in the bottom picture. Go as far as we can, and then we'll come back all the way into neutral as pictured in the first picture we talked about, the starting position.